interested in understanding how the dollars from donors or the resources from governments for the health sector can be as effective as possible in achieving health goals. As part of that work, we became really interested in a whole range of experiences that are now underway in which incentives are provided on the basis of performance. We looked across the range of those experiences, and with that and expert input, we developed a book that provides really a wealth of information about how well these kinds of programs work, what the design kind of guidance should be, and how they should be implemented.
All health systems have to take limited resources and reach a large number of people with a wide array of health interventions. The added challenge in developing countries is that the resource base is generally much more limited for accomplishing that set of objectives.
There are many different kinds of incentives that you can imagine. Financial incentives that are provided to healthcare facilities or teams or individual health workers, a little extra pay. Food that's provided to patients when they return to complete their course of treatment. And another kind of incentive is a cash stipend that's given to moms on the condition that they take their kids for well child care like immunization services or growth monitoring.
They focus everyone's attention from the highest level right down to the health worker on results, on the actual performance. Are you actually immunizing a child? Are you ensuring a woman is delivering her baby in a health facility?
Linking some payment to delivering quality services through performance-based incentives may be that extra catalyst that makes the difference. Rwanda is the first country that is integrating performance-based incentives into their full national model.
We have split the country into different categories, and we have compared areas where we distributed resources based on inputs rather than on results, to areas where the resources were based on results. We noticed that where resources were linked to results, achievements were better. As a consequence, we have decided in April to extend the approach nationwide.
There's a quality assessment done, and if quality is good, they're able to earn the full amount of money. But if quality is less than 100%, the amount of funds given to health facilities and hospitals is somewhat lower.
Everybody in the health facilities there know we have to work to improve the quality if we want to have at the end of the quota. When a community health workers bring somebody to deliver at the health center, they give them an incentive like 500 francs, so which actually also motivate the community health workers to identify all the women in the community and bring them to the health center. So that has improved the attendance of women delivering at health centers.
The nurses have been going to the villages to encourage them to come and get tested for AIDS. Every time when we come, they teach us about different things, such as nutrition, diarrhea, and dehydration.
When I came, my service had at maximum 20 patients, but now we reach about 60 patients, which means that the personnel of this service is working very hard.
In Haiti, U.S. aid is supporting contracting non-governmental organizations to deliver services to almost half the population. And the contracts with these NGOs has changed from the usual approach, which is paying for documented spending on inputs, to a shift towards providing some fixed and reliable funding and a smaller portion of funds that are linked to whether key results are achieved.
What was very interesting to see is that the organizations that began to get reimbursed on the basis of performance started to pay much closer attention to the information about their performance and started to look at how they were doing in relation to the other organizations. Did they need to have this many health education workers because they weren't doing any better than another NGO that didn't have those health education workers? So maybe they should change the way they were approaching their work. And once they were in that system, they did better.
You can optimize our resources you have to address some critical issues like healthcare delivery has information system. You can improve the infrastructure. I think the performance base is a tool and also a positive approach to give the opportunity to encourage people to do their best at work. And this approach can help to provide the best quality of care services to the population.
Depuis le système PB est arrivé,
Since performance-based incentives, we really have more focus and determination about reaching goals and being able to develop daily objectives about what we should have done on that day. And that way, more patients benefit.
The performance-based system has really increased motivation because it's right there. You have to work to bring the goals in, so that motivation keeps you going.
Le financement basé sur la performance.
Certainly, it has brought changes, and with this performance, it has increased the quality of service, and that has allowed more people to come and ask for the service because they know they're getting good care, good quality care. And also, performance-based financing has helped us reach a certain degree of institutional development because it allows us to have a margin in our own budget and to buy certain things that were not in the budget financed by the donors.
Performance-based incentive programs have to be very well designed because they set in place incentives that drive behavior, both the behavior of providers and the behavior of households. And it's important to anticipate how those incentives are likely to influence behavior. We need the flexibility at the operational level for people to be responsible for outputs and have freedom to use the inputs the best way to accomplish those outputs.
You want people to succeed. The idea is not to say, okay, how can we develop a mechanism so we give them less money? That's not the idea. The idea is how do you build incentive that's going to mobilize the forces within that organization to increase cost effectiveness, cost efficiency, and impact and outcome. So what you want to make sure is that they have the capacity to succeed.
We're all looking for ways to make really rapid progress to achieve important global health goals, whether it's improved child health or reduced maternal mortality, whether it's making sure that drug-resistant TB doesn't spread, or making sure that the incidence of HIV is reduced. What's important is to make sure that those resources are used as well as possible. And performance-based incentives, where you link additional resources to actual achievement of health outcomes, is one of the most promising ways to make sure that the new money that's available for global health will actually result in the kinds of health gains that I think we all want to see.